Dr. Paul B. Spiegel is the Director of the Johns Hopkins Center for Humanitarian Health and Professor of the Practice in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health. And he joins us live now from Baltimore. Paul, welcome. So what has the winter storm changed on the ground in Gaza in the past few days, and why is it now directly life-threatening for displaced families?
Well, firstly, thank you for having me. I mean, we've seen how the civilians of Gaza have suffered so much over the last 2 years, and they're living, as your reporter just showed, in makeshift shelters. They're unsuitable for normal weather, but now we're having extreme weather with a lot of rain, very, very cold rain. Over 12 people have died, and as you said, an infant died of hypothermia. So the conditions are just ripe for this winter storms to actually make the health of the population already worse and more severe than it already is.
And we're seeing in the story just before you those displaced people with disabilities living in these tents. Who is most at risk right now, and what are the immediate health consequences that you're seeing from flooding, exposure and poor shelter and sanitation?
Yeah. Well, besides, I mean, it was very poignant to see those disabled populations. We have, it's always seems to be the same group that is most vulnerable. It's always young children, infants and young children. It's pregnant women. It's often older people. And then it's those with chronic diseases or malnourished. And you know, we must remember that there was famine in Gaza City, and that there are so many malnourished children across Gaza, and malnourished children aren't able to regulate their body temperatures. So in this cold weather, together with rain and their insufficient shelters, and then their clothes are wet, they have increased risk of getting hypothermia and dying. On top of that, you have many of the latrines now are overflowing with sewage and wastewater, and there just isn't enough water to begin with. So people are going to be consuming dirty water, infected water. So we have to be very careful of infectious diseases. And then many other issues, but I'd like to mention respiratory tract infections. So there'll clearly be increases because of the cold and infection, increases in upper respiratory and lower respiratory tract infections, as well as skin diseases.
What exactly is preventing humanitarian aid from reaching people at the scale and speed needed, Paul, including supplies, fuel and humanitarian personnel?
I think the issue is that at present, there's still not, Israel's still not allowing enough material to get in. And don't forget, there'd been such a shortage for so long that it's not just the previous amount that was needed, you know, it used to be 600 or so trucks per day, but it's significantly more to make up for the gap. So it's not, and it's also not just the volume of goods that is needed, but it's also the types of goods that are needed. At this point, we need winterization materials. We need winterized tents. Right now, you saw how people were living in just plastic sheeting. Many of the tents are broken. We need emergency water and sanitation. We need pumps to be able to address the flooding. And there's also still remains a lot of insecurity. So even if the goods can get in, they can't get everywhere they needed due to insecurity, but also because many of the roads have been destroyed, and therefore there's a mixture of insecurity and lack of logistical infrastructure.
In your professional view, Paul, what are the three most urgent actions that would reduce deaths and disease in the next couple of weeks, and who needs to act to make that happen?
Yeah, so we need immediately in terms of winterization of shelter. So the current shelters, as we said, are insufficient, and so we need a tremendous amount of shelters that can come in that are appropriate for this temperature. They need to be off the ground. In this situation, as we saw in the reporting, you can't have people living off the ground, so they need to be elevated. The second area, and we need, of course, dry clothes, and we need appropriate food. The second area is emergency water and sanitation, because there already was insufficient latrines and the water was already contaminated. Now it's going to be significantly exacerbated. So we need water and sanitation kits, hygiene kits, we need jerry cans, we need clean water. And then finally, we need proper health care, my understanding is that over 50% of health facilities are missing just basic essential medicines. But we can't just deal with static health facilities. We need mobile clinics because you have people in these informal tented settlements. And so we need, and then finally, we need sufficient humanitarians that are allowed in and are able to do their job. And so who needs to do this? I think there needs to be an opening up for NGOs, international NGOs, to be able to come in. There have been restrictions on them. We do have, there's so many incredibly strong health professionals in Gaza, but we can't remember they've gone through 2 years of hell, and they also have to take care of themselves and their families. So there needs to be a surge of health personnel, primarily, I think, with international NGOs and United Nations supporting them.
Dr. Paul Spiegel, Director of the Johns Hopkins Centre for Humanitarian Health, thank you so much for your time with us.
Thank you.